There is something pharmacists see every single day behind that counter, something they rarely say out loud because it isn't their place to contradict your doctor. But after 60, if you are taking Lisinopril, Losartan, or Amlodipine, there are quiet truths about these three pills that could be the difference between protecting your heart and slowly eroding the rest of your body. And 9 out of 10 patients I see have never been told. Let me say it plainly. These are good medications. I prescribe them. They save lives. But the body after 60 does not process them the way a 40-year-old body does. And that single fact changes everything about how, when, and with what you should be taking them. In the next few minutes, I will walk you through the 3 things pharmacists quietly know about Lisinopril, Losartan, and Amlodipine in seniors. The kidney signal almost no one checks. The mineral that quietly rises until it stops your heart, and the swelling that is not a side effect but a warning. Stay until the end, because the third truth may explain a symptom you have been blaming on old age for years. For those who do not yet know me, I am Dr. Celeste Morgan, and this channel, Dr. Celeste Morgan, SHA's Senior Care, was built for one reason: to give people over 60 the honest, careful conversations that a rushed clinic visit can never offer. The kind of conversation a trusted family doctor would have with you at the kitchen table. Here is the key that almost nobody explains. After 60, your kidneys lose roughly 1% of their filtering capacity every year. Your blood vessels become less elastic, your liver metabolizes drugs more slowly, and your body holds on to certain minerals, like potassium, much longer than it used to. That means a dose of Lisinopril that was perfectly safe at 55 can quietly become too strong at 72. Without pain, without warning. It just accumulates day after day until one day you ask, why am I so tired, so dizzy, so swollen? This is not theory. This is physiology. And it is the reason these 3 medications deserve a closer look in every senior taking them. Before we go deeper, do me one favor. If you are currently taking Lisinopril, Losartan, or Amlodipine, type the number 1 in the comments. If you are not sure which class your blood pressure pill belongs to, type 0. That single number tells me how to make future videos for you. And if this channel feels like keeping in touch with a family doctor you trust, subscribe and ring the bell. This channel was made for people like you. Let me start with Lisinopril, an ACE inhibitor, one of the most prescribed blood pressure pills in the world. Here is what pharmacists notice. Every refill, they see the lab values. And in seniors, 2 numbers quietly drift: creatinine and potassium. Why is that? Lisinopril works by relaxing the blood vessels around the kidney. In a younger body, this is protective. But in an aging kidney with reduced filtration, that same relaxation can reduce the pressure needed to filter waste. Creatinine rises, potassium rises. And here is the nuance that changes everything. A potassium level above 5.5 can trigger dangerous heart rhythms, silently. I remember Kenneth, 71, a retired teacher. He came in exhausted, with mild muscle weakness he blamed on aging. His potassium was 5.8. He had been on Lisinopril for 4 years without a single repeat blood test. "Doctor," he said, "I thought tiredness was just part of getting older." That was not aging. That was chemistry. What to do? If you take Lisinopril, ask your doctor for a basic metabolic panel every 6 months after 60. Sooner if you start a new medication or supplement. Avoid salt substitutes that contain potassium chloride. And never combine Lisinopril with high-dose ibuprofen or naproxen without medical guidance, because that combination is exactly what tips the kidney over the edge. Now to Losartan, an ARB. Many patients are switched to Losartan when Lisinopril causes that dry, nagging cough. It is a fine medication. But here is what pharmacists quietly know. Losartan does not eliminate the potassium problem. It softens it. It does not erase it. And this is critical because seniors often believe that switching from Lisinopril to Losartan means they no longer need monitoring. That belief is where the silent damage begins. Losartan, like Lisinopril, blocks part of the hormonal system that tells your kidneys to release potassium. In an aging kidney, that mineral can creep up slowly, over months, not days. No pain, no warning. Until one morning, a heart rhythm changes. I think of Catherine, 68. She had been on Losartan for 3 years. She came in for fatigue and a fluttering sensation in her chest she described as a butterfly behind the breastbone. Her potassium was 5.6. Her magnesium was low. We adjusted her diet, spaced her supplements, repeated her labs in 4 weeks, and the flutter disappeared. "Doctor," she told me, "I feel like my chest is quiet again." That was not magic. That was physiology. Respected. What to do? If you are on Losartan, request potassium and kidney function checks at least twice a year. Be cautious with coconut water, large servings of bananas, or potassium-rich supplements taken daily. And if you ever feel a flutter, weakness, or unusual fatigue, do not wait. Get a blood test. Now the third, amlodipine, a calcium channel blocker. Wonderful drug. Smooth, steady reduction in blood pressure. But here is what pharmacists watch for at every refill: swollen ankles. Most patients are told, "It's just a side effect. Live with it." I want you to hear me carefully. Mild swelling can be tolerated, but persistent, worsening swelling in the legs is not just cosmetic. It is a signal that fluid is shifting out of the small blood vessels and into the tissues. And in seniors with weakened heart function, that pattern can mask early heart failure. And here is the truth almost nobody explains. The swelling from amlodipine does not respond well to diuretics. Adding a water pill on top often causes dehydration, dizziness, and falls, without solving the swelling. The real solution is usually a dose adjustment or a combination with a different class, like an ACE inhibitor or ARB at a lower dose. I remember Helena, 70, on 10 milligrams of amlodipine. Her ankles were so swollen she had stopped wearing her favorite shoes. Her doctor added a diuretic. She fell twice in 1 month. We reduced the amlodipine to 5 milligrams, added a low-dose ARB, and within 3 weeks, the swelling was gone. And so were the falls. What to do? If your ankles swell on amlodipine, do not normalize it. Tell your doctor. Ask whether a lower dose or a combination approach is right for you. Elevate your legs for 15 minutes twice daily, and track your blood pressure at home so any dose change can be guided by data, not by guessing. You have now seen the 3 quiet truths: Lisinopril and the rising potassium that hides behind fatigue, Losartan and the slow mineral creep that whispers before it shouts, amlodipine and the swelling that is not a nuisance, but a message. This was not your fault if you did not know. This was a gap in conversation, not a failure of intelligence. Most clinics simply do not have the time to explain what I just explained to you. Here is what I want you to do tonight. First, find your pill bottles and read the names. Know exactly what you are taking. Second, mark your calendar for a basic metabolic panel if it has been more than 6 months. Third, buy a simple home blood pressure cuff and record readings twice a week. Fourth, check your ankles every evening and write down what you see. Fifth, bring this list to your next appointment and ask one question: is my dose still right for my age and my kidney function? That single question can change the next 10 years of your life. You are not too old to feel steady again. You are not too old to walk without dizziness, to sleep without flutter, to wear your shoes without swelling. Your heart is listening. Your kidneys are listening. And when you give them the right information, they always answer. This channel, Dr. Celeste Morgan, Senior Care, exists for exactly this reason: to make sure no one over 60 takes a powerful medication in silence without understanding what it is doing inside them. If this message reached you, subscribe and ring the bell. Share it with someone over 60 who is taking blood pressure medication and has never had this conversation. This video is educational and not a substitute for medical advice. Never stop or change a prescribed medication without speaking to your own doctor. Everyone's body responds differently, and your numbers are your map. I am Dr. Celeste Morgan, and I want you to remember this: your body is not failing you. It is asking to be understood. Take care of yourself. I will see you in the next one.